Welcome back to Market It with ATMA, where we share the tips, tools, and strategies to help your business be successful. I'm your host, Dory, and today we have on the show founder and president of Healing Hands Wound Clinic, Mr. Ron Philipose. Welcome, Ron.
Story, thank you so much for having me here. It's an absolute pleasure and an opportunity for me to come here and meet you and to introduce our clinic to you and our viewers.
Awesome. Well, I'm so glad to have you because I know a lot of people out there, especially in the healthcare industry, wound care is kind of a niche, wouldn't you say?
Yes, it is.
Can you tell us how you got into this and what encouraged you to be an entrepreneur and branch out on your own?
So wound care absolutely is a unique and specialized field to get into. When the opportunity initially came up, I decided against it. I wasn't wanting to do wound care. That was not something I had ever done in my nursing career. I had no experience in doing.
Was it just unfamiliar?
It was unfamiliar.
Yeah.
It was something that we did not do in nursing, had no experience doing. However, my wife encouraged me to pursue wound care.
Oh, awesome.
And so it was her encouragement that led me to take my first wound care position.
Okay.
And within about 3 or 4 days of doing it, I was like, wow, this is awesome. This is what I want to continue to do.
Really?
And that's how I got into wound care, yeah.
That is really cool. So you have your own practice, or I don't know if I would call it practice, a brick and mortar of your own. You're an entrepreneur and open Healing Hands Wound Clinic.
That's correct.
From what you've told me kind of before the show, you really wanted to help your community. You and your wife wanted to go out and help. How are you helping your community through Healing Hands?
So the reason for starting Healing Hands Wound Clinic was wanting to do something more than just a job. Having been in wound care for so long, having had that experience, we wanted to do something for the community, to be able to repay the community, to serve our community better. And so that's why we decided about a year ago to start Healing Hands Wound Clinic. And it is a brick and mortar clinic located in Mansfield.
Nice.
And through it, we're able to serve patients with chronic wounds, surgical wounds. I mean, we see every kind of wound. So,
wow.
Yeah.
So kind of walk me through that. What are your clientele, your patients looking for when they come to a wound clinic?
A lot of the patients are frustrated because they've had these wounds for several months or several years. Mm-hmm. And so we've had patients come with wounds. One particular patient, she had the wound for about 4.5 years.
Oh my gosh.
And had gone to 3 or 4 different providers with different treatments, expensive products that were utilized, which just wasn't resulting in her being healed.
Right.
And so she came. And so we were able to see her and get her healed in about, I would say probably about a month.
So was her wound like from a surgery or from an injury?
It was, so wound care for her, it was due to multiple factors. Mm-hmm. It wasn't from a surgery. I think initially it developed as a result of pressure, friction, something that caused a rubbing injury. Mm-hmm. But there were certain comorbidities that we were able to uncover and educate the patient on.
Okay.
So there's certain things like if you're a smoker, if you're a diabetic, there are things that hinder wound healing.
And she wasn't privy to those things.
And she wasn't. And so being able to educate patients is one of the best things that I enjoy about wound care because that truly makes an impact.
Yeah. Is that kind of what separates you from, because I know there's wound care after you get out of surgery at a hospital, or I haven't really heard of a lot of wound care clinics that offer and do what you guys do. So kind of what sets you apart from the other?
It is truly that specialized care plan, if you will, or the treatment plan that we tailor to each patient that sets us apart. So it's looking at the patient's comorbidities. Are they a diabetic? Are they prone to pressure or injuries? What is causing this wound?
Right.
And it's providing the patient with those tools and education materials so that they can, make those changes to help them heal.
So is it kind of one of those things the feedback you get from your patients is more than when you worked for another industry, or not industry, but another business or company. You being an employee there, you weren't able to extend your healing branch, I'd say, as far as you can now with your own.
Absolutely.
Mortar, right?
Yeah. I mean, an example was I went to vote, and one of my patients was actually there. So I got to meet her and talk to her and introduce her to my wife. And this was after her healing. So that's the differential, or the difference, I guess, with being in practice for myself in my own community, because I'm able to see these patients afterwards and see the results and see the healing. And a lot of times meet their families. They introduce me to them.
How has that gone within the past year? I mean, because working under someone and managing patients is one thing, but having to manage from the time they enter the door until they're completely done is a whole different story. How are you managing that? And is it working well for you? Are you seeing any major hurdles that you wish you'd known about before?
Honestly, I handle all aspects of the clinic.
Wow.
And so, from the time the patient walks in to registration, to wound care, to education, applying the products on, I do all of that. So that's actually been really neat, because I get to experience all aspects of their care. And so I feel it's positive for the patient, because that's the feedback I've gotten, because the patient feels like they're being seen, they're being heard, and they're being valued, and we're true partners in tackling this wound.
It's almost like a whole relationship along the way. They don't ever feel like just another person.
Absolutely. Yeah. They're actually being seen and heard. And, we have set up communication where the patient's able to text me or call me.
Wow.
Basically 24/7. So whatever questions or concerns they have, they're able to get a hold of me and get a response within, 15, 20 minutes, which in a bigger facility or in a different kind of setting, that doesn't happen.
Yeah,
So,
I've never heard of that.
Yeah.
Do you take pride in that and enjoy being able to help them?
I do. And I tell my patients, whatever your questions are, your concerns are, even if it's not related to wound care, just go ahead and feel free to call me or shoot me a text. And I absolutely enjoy that level of a relationship and that partnership too. And that really makes a difference, because at the end of the day, we are partnering with the patient. It's not, this is what you need to do, go do it and come back. It's, how can we do this together?
Absolutely.
And,
there's some things you just can't, in this digital world we're in now, there's some things you just can't automate or put that warm touch on. And I feel like this is one of those things. You really need to make sure your patients or even clients or customers know that you care.
Absolutely.
At the end of the day.
Absolutely. And I think that's what differentiates us from the other clinics that are out there. Just the availability and our relationship, and the feedback that the feedback that we've gotten has been awesome, and the response has been great. And that's why my plan with this clinic is to continue operating in this type of a way.
That's awesome. So what are some of the challenges your patients are facing when wounds don't heal properly? How do they know when to come to you? Or are they just kind of at their last resort?
Yeah, and that's a great question. Again, as I mentioned earlier, there are patients that have gone to numerous clinics without seeing any results. And a lot of times it's just education. It's just, us letting them know, hey, you're not healing because maybe you're smoking, or maybe your blood sugars are elevated. You're not controlling your diabetes. Sometimes it's pressure. Sometimes it's just as easy as telling them, you need a different pair of shoes.
Wow.
Tighter shoes and some friction and pressure along those joints will cause those wounds. So I think the number one challenge is just, especially in today's healthcare industry, I guess, the push to see patients and get them out the door is so fast. Like, there's such a demand to get them in quickly, get them out, that there's not a lot of time that providers are able to spend with the patients and provide education.
Right.
And so I think that's what really has impacted us in our
I feel like in nursing and in medicine, that's kind of what you get into it for, right? So you can actually help people. But when it's just cycle in, cycle out, it's just the quality of care to some people is more important than just being seen quickly and getting out the door. It is for me anyway.
Yeah, absolutely. Same here. I mean, if I go see a provider, I'd like to feel that they've addressed every concern that I have and provided me with the necessary tools and equip me that I can, so that I can continue to prevent or,
deter them from experiencing the same thing, right? That they experience with, everybody else. You take a lot of pride in what you do, it seems like.
I do. I love it. And this is one of the best decisions I've made to be able to open this clinic and serve our patients.
That's what I was going to ask is, so we work off of, Advent Trinity works off of a build, launch, grow, scale methodology. Where would you say your wound care clinic is in that build, launch, grow, scale phase?
So we are obviously, this is just our initial stage. You mentioned the brick and mortar. We're located in Mansfield. We're seeing patients in the clinic. In addition to that, patients who are homebound, I'll go see in their homes.
Oh, wow.
So that's another level of service that we provide. We go out to the homes within the DFW area and see patients who aren't able to come to the clinic.
That's incredible. Yeah. And you work with doctors as well. Do you take referrals from doctors?
Yes, we do take referrals from doctors. So a lot of our marketing has just been through just the old school method of just showing up there at the clinics and internal medicine clinics and different clinics and just introducing ourselves and handing out some goodies and materials and brochures and just saying, hey, we're right here in Mansfield. Please do refer to us and we'd love to partner with you guys. And so, that's been one of the ways that we market.
So do you think that community and being a part of the community is very important for your marketing? Because healthcare marketing is a little different. You have doctors who are trying to just find somebody for their patients to go to help them. And then you have patients that don't want to go to their doctors anymore. So how do you balance that marketing referral basis? Would you say networking and eye-to-eye, hand-to-hand contact is probably your best route right now, or do you use some kind of other platform like Google, social media, website, things like that?
So we do use social media. In today's world, I think it's hard not to because everybody's on social media. So we do use those platforms, Facebook, Instagram, all those platforms, and putting out podcasts and videos and such. But I think at the end of the day, getting in front of a provider and introducing myself and our business is the best way to get the word out and to market. So that's our go-to method of marketing.
Right.
Going into the clinics, introducing ourselves to the staff, to the referral coordinators, to the providers, and just letting them know, hey, we're here to partner with you and help the patients in the community. Okay.
So you kind of extend a branch of service that they don't have the maybe time to focus on. You can give them that quality of care. What entices them to work with you?
The results speak for itself. And then being able to use stories from our clinic, use real life patient experiences and their stories and their reviews and their results, and being able to take that to the provider and say, hey, thank you for referring this patient. This is what how we were able to partner with the patient and get the wound to heal.
So it's kind of full circle,
Yeah. When you're able to take that story back to the provider and say, hey, this is what we were able to do in partnering with this patient, I think the results are, obviously speak for itself. And when the providers see the results, that usually gets them to continue to refer to us.
That's great. Because Google reviews are everything now, right? That's the first thing I go to see if someone matters. So you allowing them to just see and hear that patient that they referred had a good experience, that means a lot to people. Sometimes it can make or break a business.
Absolutely. And so we love sharing our stories, and we have, patient videos that we're posting soon, that patients that have agreed to share their stories. If I could share a story with you, we had a patient who came in with her mom. And so she had this wound for about 2.5 years.
Oh my gosh.
Yeah. 2.5 years that she had this wound, had gone to multiple providers. And so she came to us, pretty desperate. And you can hear that in her initial communication with us. You could tell how desperate she was, and pretty hopeless at that point as well.
Yeah.
And what also complicates things is that she was needing a kidney transplant.
Oh my goodness.
And the only way she could get put on the list was if this wound was healed.
So it was almost life-altering for her.
Absolutely, yeah. It was life-threatening, life-altering event for her. And so, through just those principles that we talked about earlier, educating the patient and the proper wound care and the specialized wound care and the advanced wound care that we were able to provide for her, we were able to get her healed in about 6-7 months' time.
That's incredible.
Yeah, I mean, it's a beautiful story, and I share that with, a lot of my colleagues. She just actually texted me a few weeks ago that she got put on the transplant list.
Oh, that's incredible.
Yeah.
It's really life-changing. People don't realize how much you caring can change so many different things in your community, in your environment. So thank you. Thank you for her. So she's doing good now?
She's doing fantastic, and her mom are just advocating us and spreading the word and letting everybody know that we're there. And it's just awesome as a provider to share those stories and be a part of their lives and be a part of the transformation that's about to happen with this transplant, hopefully, that she'll get.
That's incredible. Absolutely incredible. So how did you go from... Okay, we got the brick and mortar. How did you kind of strategize your marketing plan? Was it kind of a faith-driven quality of service, like you mentioned, or did you have a strategy for other entrepreneurs out there wanting to branch out?
Yeah, I mean, I think one of the biggest thing is, as an entrepreneur, you want to make sure you surround yourself with mentors. And so that was huge for me since day one, even before the planning of the actual clinic itself, was getting together with mentors, taking their feedback, their thoughts, and applying it. And so that was huge for me in coming up with a marketing plan.
So they kind of helped you navigate the path of do's and don'ts.
Yes. Yeah. Their experiences, what's worked for them, what hasn't worked for them. And we've been able to use those tools and use that for our clinic.
That's incredible. So what are your plans or future goals for the clinic? What do you have in mind in your 3 to 5 year plan?
At this point, our plan is to continue to grow the clinic. And as we continue to grow, DFW is huge.
Absolutely.
And the growth that's happening here is just immense. Anywhere you look, there's new apartments and new complexes, new homes being built. So I think there is a great need for wound care in the DFW area. So in the next 3 to 5 years, I see myself launching multiple locations in the DFW area and being able to provide this level of service to other patients in the DFW area.
That's wonderful. So do you have any criteria? Do you accept patients with insurance, without insurance, all of the above?
I'm so glad you asked that. So we are partnered with a company that does the credentialing for us. And so we take Medicare, Medicaid, all different types of insurances. And we also do cash pay.
Wow.
Yeah. We do cash pay. And because I'm not affiliated with a hospital, I'm able to provide services at a lower cost. And sometimes, that means the underinsured or the underprivileged, and be able to provide services for them regardless of the cost.
Man, that's incredible. I know a lot of nonprofits around here really want to connect their nonprofit community with other businesses in the area that are really looking to help people. So I would really like to refer you, because you never know what people are, hiding underneath their clothes they really need help with.
Absolutely.
So have you ever run into a wound, I'm just curious, that you couldn't fix?
There are some wounds that, due to multiple reasons, like we talked about earlier, if it's patient noncompliance, that's a huge issue when it comes to wound healing. There are those patients that just don't listen for whatever reason. And they just don't follow the practices and the guidelines that we tell them to do. And then sometimes there are just conditions that just don't close up, or wounds that don't close up due to underlying conditions that we just can't manage.
Wow.
And so those are the times that, again, we partner with other providers like plastic surgery or general surgery, and we refer patients to them.
Wow.
Where they're able to help close up the wound.
So you really, really have to know your community and who you can trust in this industry, healthcare especially, it seems like.
Yes. And the one thing with wound care is we partner with pretty much every specialty out there. So from internal medicine to endocrinology to manage their diabetes, to nephrology if they have kidney issues, to plastic surgery or general surgery if they need surgery. Basically, every specialty out there we're partnering with and working with.
It sounds like you're a connector. You kind of know a little bit of everybody to get you to where you need to go.
Yeah.
Hey, that's important as a doctor. If you don't have good referrals, I'm a little concerned when I walk out, right? So do you have any advice, recommendations to patients, prospective patients, or to your practitioners that you'd like to work with or currently work with that you wish you would have known prior to being an entrepreneur? Tips, tricks, strategies, what you wish you would have done? There's always something I think about, like my husband coaches basketball, and I was like, if I had known that managing people was the primary portion of this job, I would have probably approached it a little bit different. So we always like to help our listeners who are business owners like you. I mean, look ahead. If they're just starting out and don't have a brick or mortar, what should they first get in place before they branch out to do those things?
I think for me, one of the biggest things was having people around me, mentors, as I mentioned before, who are able to guide you, because that was the biggest I guess early on, one of the things I realized, the importance of connecting with other people.
Right.
Because you never know who somebody else knows or who's, who you're able to network and meet through somebody else, and the feedback or the education that they're able to provide you and the guidance that they're able to provide you.
It's so funny. I would say 80% of my guests on the show would mention that, like having a mentor that's been through it before is the gateway.
Yeah. Because as a new entrepreneur, there's so many times when you panic and you're like, am I doing the right thing? Should I have done this? And having that mentor to just guide you through and say, no, it's okay. This is what I went through as well. And I think that's huge in continuing to stay the course.
Absolutely. A sense of reassurance almost. So to our listeners out there who maybe are interested in your services or want to just learn more about what you do, how can they reach you?
They can reach us multiple ways. As I mentioned, we're on social media. They can look up Healing Hands Wound Clinic on their social media to find us. And then we have a website, which is the address is www.hhwoundclinic.com.
Awesome.
That's another way to look us up, and all our services that we provide are listed there. Awesome. And of course, through phone. They can reach us through telephone. They can give us a call at 817-380-3201. And we are excited to meet patients. And if there's providers out there that want to meet and partner with us, we're looking for partnership there as well.
They can reach out to the same number, same site and everything.
Yeah, same number, same site, and they can find us and reach out to us. And
I think you have made it the easiest for anyone to reach out to and really understand. Thank you so much for explaining all of that. I'm so much more aware of what I should and shouldn't look for. Don't just go to any doctor. Know your doctor.
Absolutely. Thank
you so much, Ron.
Thank you so much. I appreciate the time and appreciate this opportunity, and very nice meeting you.
Oh, I'm sure we'll see you again soon. And for all of our listeners out there, we'll see you next time on Market It with ATMA.